Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister, thank you so much for joining us.
Thank you very much for having me on the program.
Yes, sir. My first question, with 50,000 more vaccines becoming available and the possibility of reaching herd immunity increasing, what are some of the likely changes we would see as we approach this particular milestone?
Well, first of all, it's not 50,000 vaccines. It's 100,000 vaccines that we have purchased.
Yes, yes.
And that 100,000 vaccines would help to fully immunize 50,000 people.
Yes, thank you.
So, as of yesterday, as I said, we have received the majority of it. We have received 88,000. And so by Saturday, we'll get the rest. So within the country, we'll now have this 100,000 doses. We are still far away from herd immunity, because for us to get to herd immunity, we are projecting that we need to be approximately about 80 to 85% of our adult population being fully immunized. As of yesterday, we're only at 22.7% of our adult population that is fully immunized. So the vaccines that we have would certainly help us to get there, but we need people to come forward and take the vaccines. And I'm very hopeful that more and more people would understand the importance of getting vaccinated, because without vaccination, you're putting yourself and your family at risk. So we want to constantly repeat that message, because that's very important.
I know it's a bit too early for this to say how people have been responding to this vaccine, but I know from the earliest, persons have been responding positively to the Sinopharm vaccine. And as we're on that note, how has the campaign been going?
Well, as you would know, that early in our vaccination campaign, we did receive 20,000 doses of Sinopharm vaccines, which was quite well received by the population. And so we will be using this 100,000 doses that we have and be sure that the response would be good. We have started the distribution of those that we have received. So we're sending them out to the region. And one of the advantages with this particular vaccine is it does not require the ultra cold storage or the really cold storage, which is -20. These are vaccines that can be stored from 2 to 8. So we are very happy with that, because it allows us to move them to very remote places as well.
Yes, sir. All right. Could I ask you for the current vaccination figure?
So as of yesterday, we've had 233,756 persons who have received their first dose vaccine. And we have 110,710 persons who have received their second dose vaccines. So I think we are gradually getting there, but we need more people to come out. The faster people come out, the more people we'll be able to immunize.
All right. And for this 110, 710, this is the 22.7% that you noted earlier.
The 22.7%, yes.
Thank you, sir. I wanted to quickly ask you, I know yesterday that the Prime Minister and yourself included were basically briefed by SEDEMA on the flood situation in Ghana. I wanted to ask you what your thoughts on the impact the flood had on the health sector.
So SEDEMA was doing a damage assessment here in Guyana, and they looked at several sectors. And of course, we have seen the damage devastating a lot of farms and livelihoods for people and mining areas. So I think as part of the damage assessment, they paid close attention to those things. In terms of health, in the report, at least some of the preliminary findings, they have suggested some additional actions in the future that perhaps the health ministry can take, and we will review those recommendations when we get them to see how we can implement them. But by and large, I think the health sector performed well. As you would know, during this period, while I would say more than half of the population were at risk for these flooded waters, we didn't have any case of drowning. We didn't have any outbreaks of any sorts. We were on the lookout for acute diarrheal diseases, especially among children. While we had a few cases of those, it wasn't anything that was overwhelming. So I think, given all the challenges that we currently have, rolling out vaccination and looking at other things and so forth, that the health system performed relatively well. And I would want to acknowledge the work that the nurses and doctors and other professionals in the health system would have done in the various regions to make sure that people stay safe.
Sure, thank you. I have two mythbusters that I wanted you to respond to. The first one is rinsing your nose regularly with the saline or saline solution prevents COVID-19.
Well, there's no scientific rationale behind rinsing your nose would prevent COVID. I haven't seen any studies that address that. But if you're going to go to the extreme of rinsing your nose every day or twice a day, then the simpler thing to do is to use a mask that protects the viruses from getting into your nose. And that's what mask wearing is all about, to protect your body from coming in contact with, with viruses. So if you wear the mask, there's no need for you to rinse. Having said that, however, there are some people who are fearful of getting an injection. And so there are several companies now that are working to develop vaccines that you can spray into your nose rather than be given as an injection. So those companies are working on vaccines like that. But I haven't seen any scientific study that suggests that rinsing your nose would protect you from COVID.
Okay. The last one, eating garlic will prevent you from COVID-19.
Again, I think that's a myth. Garlic, by some of the studies, it has some beneficial value. And there have been some studies that show people who use garlic would have maybe better blood pressure, and it helps in some ways to prevent cardiovascular diseases and so forth. And there are some studies that attribute some positive response of garlic with diabetes. But having said that, there hasn't been any study that was done of garlic and its impact on COVID-19. So out of an abundance of caution, I think people should use the known preventative measures that are working, which is social distancing and masking. And if you want to boost your immune system, then you can use some of the vitamins and so forth that people would normally use. But the best way to protect yourself from COVID is really to get vaccinated. Because if you're vaccinated, then these vaccines are going to stimulate your immune system to produce the antibodies that would fight off the virus. And once you have that protection, then you would not be at so much risk for getting the infection or hospitalization and even dying from COVID.
Okay, sir. Thank you so much for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.